Walked into the house, proceeded forward, saw a patient on the floor to the right, proceeded to the patient to start an assessment and evaluation.
And then Captain Keller had already come in.
I'm pretty confident, yes, he would have been quicker getting off the truck and inside.
And so you did your assessment, and then what?
My assessment revealed that he was unresponsive, no pulse, no breathing, so I would have started CPR, started chest compressions.
Did you do that with his shirt on?
I would have lifted that out of the way so I could find the proper landmarks.
So you had said that you saw that there was, let's see, 2 gunshot wounds, is that correct?
Yes.
And then you saw that through the shirt? Or how did you assess that when you first entered? That's my question.
Once I'm doing CPR, I can see 2 bullet holes in the shirt. I can see that on the chest and on the abdomen. I can see the wounds as I'm looking at the chest and doing chest compressions.
Okay. And then he had on what color shirt?
I wouldn't have recalled other than, I guess, the video yesterday. I think it was a dark colored shirt I think we saw on the screen. And
so you had talked yesterday about the blood being more blood on chest, not pooled around your knees, right? Is that correct?
Correct.
And so with the dark shirt, was it hard to see the blood? I'm kind of trying to see what you saw when you entered.
I remember seeing blood on the chest. It wasn't, I remember not seeing blood on the abdomen.
And there were holes in the shirt, 2 holes in the front side?
I would, best of my recall, yes.
Okay. And when did you cut off the shirt, and how does that procedure work?
I continued doing CPR, chest compressions. One of my other colleagues would have cut that off, and knowing that the shirt maybe is potentially evidence, that's why I said to her, don't cut through where the holes are. So she could have cut down the side instead of on the top of the body.
And do you use like a special scissors or something for that?
Yeah, we have some trauma shears in our equipment.
Okay. And who was that? Was that Phelps? Or?
I believe that was firefighter Kaczynski.
Okay. Kaczynski, that's one I didn't have. So who all was sitting there with you that was on scene at that time?
Firefighter Fife would have been there. Mm-hmm. Firefighter Kaczynski, the 3 of us, kind of like we saw in the video or I get the picture yesterday. All 3 of us around the patient, while Captain Keller was standing back a little bit, like you saw in the picture.
Okay. You said that you had been a CPR instructor for 12 years. Is that correct?
Yes.
Okay. And was that for the last 12 years or 12 years ago?
Approximate dates, 2004 to 2016, let's say.
Okay. And so have you taught people who have never done CPR before?
Have I taught those individuals? Yes.
Right. And not just like people renewing their certification, but both?
Correct.
Okay. How many people would you say that you've taught that have never done CPR before?
Never done CPR, and it's probably in the hundreds over that long of doing that.
So you'd be familiar with how a first-timer would react?
Yeah, you try to forewarn them what to expect.
Okay. So these first-timers, they have to be taught the appropriate place to place their hands. Would that be fair?
That is part of the course, yes.
And so do you show them, or do you just tell them in class where to put their hands?
It's a video-based system through American Heart. There's a curriculum that we would have been following.
Okay. So if you could only tell them, like over the phone, that might be difficult for them to know the correct placement of their hands if they've never done it before.
I guess it depends on the instructions that the dispatcher gave. Ultimately, if I was telling somebody over the phone, you want to put your hands on their chest, on the lower part of the chest. It's that kind of simple, so to speak.
Okay. But without the video, if you were teaching a class and you didn't have the video, it might be difficult, right? For a bunch of first timers?
Objection, speculation.
Overruled. You can answer.
Does it mean answer? Oh, okay. Sorry. Can you repeat the question then?
Yeah, so it might be difficult. If you didn't have the video, it might be difficult, you know, for a bunch of first timers to know exactly what to do if you just had to tell them middle of the chest, lower chest.
I mean, you could obviously show on a person. You could show on yourself.
If you couldn't show them and you could only tell them, could it be difficult?
I suppose it's possible depending on the person.
Okay, that's fair. So do you think that your CPR class would be fairly successful if you had no visuals?
Objection, relevance, speculation.
Next question.
I got it, Your Honor. So if a person had never done it before and was just told how to do it, is it possible that they might not be acquainted with where to put their hands?
It's possible.
And it would also be possible that they might not do it properly.
That could be possible too.
And right now when you're teaching CPR, and I didn't say you are teaching right now, but if you're teaching a class, are they just doing percussions now? There's no breathing in the mouth, is that correct?
It's going to depend on the level of the class. As far as the lay rescuer, people that have never done it before that just want to have the training, it's evolved and we're teaching compression only. That is a form of CPR now also, just doing chest compressions.
And how long do you teach to do that for? How long of a period before you take a rest? Or
Well, it varies depending on if the patient is an adult or a child. There are different guidelines that American Heart offers. So in those courses, they're getting to learn information for adults and children and infants also.
Correct, right. So for an adult, how long, like 30, 100, 150? It's been a while, so just wondering.
With an adult, they're also taught they need to call for help right away also. So that's a factor. Are they alone? Is somebody else able to call? Can they call, put the phone on speaker, start, while talking to 911? And then they would just keep going until help arrives.
So there's no timing, like you take a 10-second break, you just do compressions?
Not for that type of level of CPR, there wasn't.
Okay. So it's helpful if you had someone there that you could take turns, like I do 100 and then you do 100, because it's kind of exhausting, right?
Objection, compound question, relevance.
I'll sustain it as the compound question. You can re-ask the question ask it in a different way. Go ahead.
So how long did you administer the CPR before you did the flip over? How long do you think that was?
Before we rolled him to look at the back, is that what you're...
Correct. Yes, that's correct.
I would estimate maybe up to a minute.
Okay. And then were you counting compressions? Is that what you were doing during that time, or do you not count? You just do it for a certain amount of time?
I don't recall if I was counting. I mean, I was doing the chest compressions while waiting for the rest of the team to arrive and for us to continue assessing, see if we're going to continue to work the patient and utilize more equipment.
And there were 3 of you there?
4 total, but 3 by the patient.
Okay. And then you could take turns, right? Like trade off if you needed to?
If we needed to, yes.
So that'd be a lot easier than when you're just there by yourself. Would you agree?
Yes.
Okay. And do you know how long How long after the rolling over did you started doing compressions again? Is that correct?
Yes.
That's what I had.
Yes, I believe so.
And how long did you do that for?
I would estimate maybe upwards of another minute
So maybe 2 minutes total?
during that sequence, yes.
And was there another sequence?
At some point, we would have stopped doing chest compressions so we could evaluate the heart rhythm. That's on the heart monitor.
With the heart
And
monitor?
you can't be doing compressions to evaluate that.
Okay. And then you didn't continue compressions after the heart monitor at all?
From what I recall, I resumed again in brief discussion as far as what direction we were going to go.
And what were the results of the heart monitor?
There was no electrical activity.
And how long was the heart monitor applied compared to when you started the first compressions?
I'm not sure if I understand the question. Maybe you can reword it or...
Sure. How far into your treatment, I should say, did you guys stop and do the heart monitor?
I would estimate that the monitor probably was on within 2 minutes of making patient contact.
Okay. And how long does that take?
To do what? To put it on?
Well, to put it on, get a reading, and decide what you're going to do next.
It could take, you got to turn it on, open up a compartment to get the pads out of that compartment. You've got to open that packaging to be able to apply it to the patient's chest area. If the chest is wet, which there's some blood, you need to dry that so it's going to adhere more properly, read more properly. So you could be looking at 30 seconds to a minute possibly of working through that.
Okay. And did you have to do that in this case, is remove blood to stick them on?
I would assume so, but I was doing chest compressions, so that would have been one of the other two firefighters kind of working through that.
Okay. So I understand correctly, you said when you rolled him over, did you cut the shirt in the back also to see the exit wounds? Is that?
No, we only had to cut the shirt one time. That was when he was still laying on his back. You cut it down the side, and that opens it up to where then you can remove it from the body, pull it off.
So you did pull it off completely at some point?
More than likely, I would say yes. That's typically what we would do.
Okay. But you don't remember if you did that in this case?
I know that I didn't do that because I was doing chest compressions, so I would assume one of my colleagues did that completely. That's typically what we do.
Okay. And so you're back to doing the compressions for the third time, and then you stopped that at some point. Was there another procedure after that?
No, at that point in time is when we would have called the patient.
And who announces that?
Ultimately, I remember our captain, since he's in charge of the crew, would be considered the lead medic. He has the most experience. He's also charting the call, kind of running it, kind of made that final decision.
And that would be Captain Keller? I'm sorry, I didn't want to interrupt you.
Yes, correct.
Okay. And then he did call it at, do you know what time?
It would have, I don't have it memorized, no. It would have been like in the charting that he was doing.
And who documents that?
He would have documented
He would have
that.
done it? Okay. In preparation for your testimony here today, did you review the 911 call at all?
No, not in preparation for today. Not the actual audio, no.
No.
No, not today, not for this.
What did you review for today?
I was able to look at the incident times were dispatched by Phoenix Fire Department. I was able to look at the paper documentation, I was able to see my testimony from Idaho. I was able to see my testimony with Chandler PD when they came to the fire station a couple of weeks after this incident.
And what paper documentation did you actually take a look at?
It would have been the chart that Captain Keller documented.
And what does that chart consist of?
There would be scene times, date, time, address, patient information, name, address, maybe medical history, things that we, a narrative of what we discovered, what we've done, treatments that we've done. The heart rhythm from the monitor gets attached to it.
So that would all be in Captain Keller's report?
Correct.
And you did take a look at that in preparation for today?
Yes.
And did you write a report regarding this incident?
No.
You don't have to document anything?
Just one person documents the call.
So for all of the people that were there from fire?
Correct.
Okay. So that's the total report. Is you just give your input to him and he puts it into the report?
Correct.
And that's the same for the other two firefighters that were along with you?
That's correct.
Okay. So they don't have their own individual reports as well?
No.
Okay. And what time were you dismissed from the scene?
We probably only remained an additional 5 to 10 minutes. The chart would have that time. I don't necessarily have it by memory.
So how long were you at the scene total?
If I had to estimate without looking at it, I would say approximately 20, 25 minutes.
Okay. And then you were like the driver of the truck, right? Was that your responsibility? So
Correct.
you drove in and then did you drive out as well?
Correct.
Okay. So if you guys arrived around 8:41 or something like that, then you left around 25 minutes later? Would that be accurate?
I guess when I was giving that estimate of the 2025, I was even including our dispatch time from the time we're dispatched driving to the scene. So if you're wanting to know actual on-scene time, it might be closer. Instead of the 20 to 25, it might be more of a closer to 20 solid.
20 minutes?
Yeah.
Okay. And is that typical for a call?
It can vary depending on the calls.
Okay. So what other things did you do in that 20 minutes besides administer to the patient?
So I'm including in that time while we're staged around the corner, waiting for PD to arrive, then for PD to clear the scene, for us to drive to the scene. There's the time with the patient, and then there's going to be the cleanup afterwards. Removing our equipment, going outside. Maybe the equipment needs to be cleaned, restocked, ready for another call. So when we drive away, we're ready to respond to another emergency and then drive away.
Okay. So when you were done with the patient and you were going through that procedure of cleaning, were you in the house or did you exit the house?
We'll remove all of our stuff and we'll go outside, typically to the front bumper of the fire truck.
And then what do you do?
We have cleaning chemicals on the truck that we could get out to, clean our equipment up to reuse it. We've got cabinet with restock to be able to restock anything that might need to be. So we'll take care of those things to be ready to respond to another call.
Okay. And while you were out front, did you see Alex on the curb?
I did see somebody on the curb, or I don't remember if he was on the curb or standing, but I remember seeing somebody with an officer or officers. I don't recall how many people might have been together.
Okay. And did you converse with those officers at all during that time?
I don't believe so. I don't really remember conversing with any officers on scene. That would have been more Captain Keller, charting, documenting, kind of getting information from them. He would be able to answer that question.
Okay. So did you, was anybody in firefighting on your team, the four of you that were there, was anyone asked to take a look at Alex?
We were not.
Let's see. Have you spoken to the media about this case?
Can I object? Relevance?
What's the relevance?
What is the relevance, Your Honor?
Yeah.
Just to know how many times he's given testimony?
Your Honor, I'm
Right.
going
I'm gonna
to, maybe we can
hold on.
sidebar.
Yeah, I don't want to. All right, let's go on a sidebar.
Mr. Cowden, is it possible that if there was a wound to the chest, that doing compressions on that could cause other damage?
I suppose it's possible, but ultimately it doesn't matter. If the heart isn't beating, it's what you got to do. It's the appropriate treatment.
So would a common person who doesn't know how to do CPR maybe hesitate about pushing on a bullet wound?
Objection, speculation.
Sustained.
But you wouldn't.
Can you repeat the question?
You wouldn't hesitate to push on the bullet wound if the heart was stopped?
No, I wouldn't.
And you would have to assess if the heart was stopped in order to do that?
Yes, you would check a pulse like we did. We would, use our equipment like we did.
Okay. So the two wounds that you saw when you first got there, one was in the chest and one was where?
In the abdomen.
On the right side or the left side?
I would be speculating as to how the specific spot or area without actually maybe seeing documentation.
Okay. And can you tell me about I think there's a word for it, but I'm sorry, I can't remember what it was. The crunch.
When doing the chest compressions?
Correct.
I don't know if there was necessarily a certain word that I used, but you feel the sternum crack. I compare it to, like I said before, cracking your knuckles.
And how much pressure would you have to apply to get the crack?
That could vary, like depending on who you're doing CPR on.
Like on an adult male?
I mean, it could still vary depending on, the strength of the person doing CPR also. It could vary depending on the size of that adult male also. So I've never seen like any science that might say you got to deliver this much pounds of force or anything.
Right,
So,
like 400 pounds of pressure or something?
yeah, I don't know. Right.
Okay.
You're just
So
going to push
there isn't-
hard.
Hold on.
Sorry.
Sorry.
Can't have you talk over one another. So he's finished his answer. Go ahead and answer your next question.
So there's no determined amount of pressure, correct?
Just hard and fast. When it comes to people doing CPR, for us, we're working as a team. We have equipment that can tell us if we're pushing hard enough. For a person without that equipment, just hard and fast.
Okay, that's fair. And then they don't always get the crack, right? It's not always going to happen.
If they're doing it forcefully enough, they would.
So if they didn't do it forcefully enough, it wouldn't.
That is possible, yes.
But then when you come in, the professionals, and you apply the correct amount of force, then you would hear the crack.
Yes,
And is that possible that that happened in this case?
it is possible.
Okay, no more questions.
All right, redirect.
Does 911 have to regularly instruct people on how to perform CPR?
I don't know if I can answer that since I don't, do that since I'm not 911.
Have you regularly heard while listening to the radio 911 instructing people on how to do CPR?
We have had PTI information when we're responding to a call that will tell us that they are either performing CPR or being instructed to.
So you've seen in the past that 911 is prepared to handle individuals who may not know how to perform CPR.
Yes,
And that's to help try to keep the patient's blood moving while you're en route.
correct.
You were asked a lot about trading off and other people doing compressions. At this scene with this patient, Charles Vallow, did you ever trade off and have someone else do the CPR compressions?
No,
You were the only one doing the CPR compressions.
yes,
Were you doing CPR while another paramedic or EMT was getting the heart monitor ready?
yes,
So this timeline of however long it took them is in conjunction with you still performing CPR.
yes,
You talked about Charles's shirt being cut. If photographs from the scene show his shirt still around his neck, would that indicate that it wasn't removed from him?
After the cutting,
Yeah, so if police, let me ask you this. When you guys are done and he's called deceased, do you put his clothing back on or modify him in any way?
no, we would just take our equipment that's necessary to take.
So if his shirt was still around his neck, then that's how it would have been left.
Correct.
You were asked about whether or not you should perform CPR on a person who has a gunshot wound. Is there any reason why a person with a gunshot wound would not need to have blood circulating through their body to bring oxygen versus some other type of injury?
No,
Is the whole point of CPR to make sure that blood is circulating to get oxygen to their brain
yes,
so that they don't go brain dead?
yes,
And you said that ultimately it wouldn't matter if you cause more injuries because if they're brain dead, who cares, right?
correct.
In your assessment, did you feel that no one had performed CPR on Charles Vallow before you arrived?
I had felt that, and I do know in my testimony to Chandler PD I had stated that, or it's probably in my testimony that it was not efficient or something to those lines. But I felt like no, it had not.
Okay, you felt like no, it had not been done.
Correct.
Thank you. I have no other questions.